Hi, welcome Dr. Barnes. How are you today?
I'm pretty good.
Wonderful. So today we're going to be talking about iPods, how loud is too loud, and rules of thumb when you're listening to your iPods. So the first thing I'd like to ask you is how a lot of parents worry that their kids, first of all, are listening to their iPods all the time and listening them too loud. I know my husband likes to listen to his iPod with his headphones over before when he's cutting up wood and that sort of thing. So, and when we take long trips, we just plug the kids in and we go. And it just seems to make us feel a lot better. But at what point do you need to worry about your kids listening to music all the time with headphones in?
Wow, lots of questions there. Well, the biggest thing about iPods is how loud you're listening to them and how long. It's the combination. In and of themselves, iPods or MP3 players, whatever you want to call them, are fine.
All right.
But it is how loud you turn them up.
Okay.
We know that the ear is easily damaged by loud sounds. What happens is that in the ear there are these little hairs. They're like little hairs that stand up like this. And when sound comes in, it's a wave, it's a vibration.
Right.
It comes in and it shakes those little hairs. And they rock back and forth gently and send the message up to the nerve and up to the brain that you've heard something. With loud sounds, whether it's noise or music or whatever it is, if it's loud enough, those little hairs, instead of rocking back and forth, they go, they collapse.
All right.
Okay. Now, sometimes they recover, but over time, they stop recovering, and little by little, they become damaged.
All right.
And then you end up with a hearing loss.
All right.
Okay. Because you don't feel it, it doesn't hurt. People say, well, that loud music doesn't bother me. That chainsaw doesn't bother me. They don't feel it bothering them, but it really is. It's kind of sneaky.
So it's a cumulative effect.
Exactly.
Things that when our kids are listening to their music too loud when they're young, they'll probably experience hearing loss at an earlier age than someone who didn't ever listen to that, like our parents' generation.
Definitely. In fact, they find that the rate of noise-induced hearing loss in young people, 9 to 16-year-olds, is increasing.
All right, wow.
So it's important to be aware of that.
Right, absolutely. So how do you know it is too loud? How loud is too loud?
Good question. We know that iPods, the maximum output of iPod, it runs about 103 to 108 decibels.
All right.
That's pretty loud. In industry, OSHA has designated 85 decibels as the cutoff for where sound becomes dangerous. And they've limited the amount of time that you can listen to 8 hours.
All right.
As things get louder, you have to decrease the time. So by the time you get up to 103 decibels, you're talking about only being able to listen safely for about 7 minutes.
Wow.
Yeah, about 7 minutes, I'd say, which most people don't do.
No, absolutely not. So if you're standing next to someone and you can hear the music that they have in their ears, is that an indication that it's too loud? Or as a parent, how would we need to actually put the headphones on ourselves and listen?
Good question. If you can hear it, it doesn't necessarily mean that it's too loud.
All right.
Or if you can't hear it, it doesn't mean that it's not too loud.
Okay.
Because that really depends on the headphones that they're using.
All right.
Okay. A better guide would be if you start talking to them and you're only about arm's length away, using a normal tone of voice, and they can't hear you, then it's too loud.
Okay. All right. That's good to know.
Some other, I'm sorry I interrupted you there.
No.
Some other guidelines would be, if you really want to rock out, you want to listen to that song loudly, you can listen and feel fairly safe if you limit your time to 60 to 90 minutes.
All right.
With the volume only at 70 to 80% of full volume. Okay?
All right.
Better yet, keep the volume at 50% or lower, and then you can listen to it as long as you want.
Wonderful.
Okay.
Now, you mentioned headphones. Is there a difference? Is one kind of headphone better than another kind, or less likely to damage your ears? The ones that fit in your ears, are they worse for you?
Not necessarily.
Right.
Whether you wear buds or over the earphones doesn't really make a difference if they're standard phones.
All right.
What does make a difference is if you use noise cancellation phones.
All right.
Because what we know is that people, when there's a lot of background noise, that's when they crank up the volume.
Right.
Which you mentioned before in the introduction that your husband likes to wear the iPod underneath his muffs or with his muffs or something. It is really not a good idea to use iPods as noise protection.
Okay.
Now, at least he had his muffs on over them. That was good.
Okay.
But I've met people who tell me, yes, I use noise protection. I mow the lawn, and instead of using earplugs, I put in the iPod.
Right.
And what happens then is they're just cranking it up, and now the damage is coming from the music instead of the lawnmower.
So as we finish up, is there another key take-home message that you really want people to know and to understand when it comes to listening to music through their earphones?
Well, I think the bottom line is limit how loud and how long you listen. And regardless of how careful you are, if you start to notice that your ears are ringing or buzzing after you listen to music, or that the music is starting to sound distorted or speech is muffled, then you need to really lower it, because everybody's different in their susceptibility to loudness. So, and that could be a sign that you are doing damage.
Wonderful. All right, so that is some really great advice, and I think that this is something that's a really of concern to a lot of parents, since our kids, I mean, my 10-year-old has her iPod on all the time. It's younger and earlier and longer. So I'm definitely going to take home some of this information and check and see if my kids are listening too loud or too long. Thank you, Dr. Barnes.
You're welcome.